The number of newborns taken into care dropped dramatically as birth alerts ended across Canada. However, child welfare experts warn that ceasing the practice alone cannot be the only step that governments take to keep families together. The latest census data from StatsCan indicates Indigenous children continue to be overrepresented in the child welfare system. They make up 53.8% of foster care children in Canada. Advocates point to the children who were taken from their families through the residential school system and the 60s scoop that continue to face mental health issues and trauma. Cora Morgan from the First Nations Family Advocacy Office says that government reforms alone won't get to the root of the issue and that officials need to invest in prevention and healing. Ms. Morgan joins us now. Ms. Morgan, welcome to Forum Daily.
Hi there. Thank
So,
you for having me.
so let's start with how the practice of birth alerts has impacted First Nations communities in Canada in particular.
Well, we've had over 150 years of stolen children from residential school to 60 scoop to, the practice of day school is now the current child welfare system. And one of the common practices has been the use of birth alerts, meaning alerting that a mother is potentially unfit to parent her child. And so, um, that was the act of issuing these alerts on mothers and then different entities intervening and perhaps apprehending the baby at birth. And so there's two things: there's the use of birth alerts and unfairly targeting mothers, and then there's also the actual act of taking newborn babies, which is really devastating.
And many experts, including yourself, say ending birth alerts is just the first step to addressing these systemic issues that are facing Indigenous children in childcare. So, what are the other steps that need to be taken?
Well, of course, we need to use birth alerts. We also have to go back to restored jurisdictions of our First Nations, being able to take control of the child welfare systems and implementing, First Nations led approaches to caring for children and families. We need to do a lot of work to address the social issues that have become quite challenging and rampant as a result of over 150 years of stolen children. Our elders say the most violent act you can commit to a woman is to steal her child. And so when you think about, the hundreds of thousands of First Nations people who've been affected by having their children taken and those children being displaced, there's a lot of damage that's been done. So there's really a need for, healing and getting to the root cause. And, we have really challenging issues of poverty in this country and, particularly here in Manitoba. We have the biggest riding in all of Canada, and over 60% of the children are living far below the poverty line. So, when you have those kind of issues that are happening in our country, those things need serious attention and address, and real commitments to create change and finding alternatives to apprehending. A lot of times when you've taken so many generations of children, you need to be able to invest in bringing back ability to parent. So many people have been taken by systems that when they go and have their own children, they've never been raised in a loving, caring home, and really need to have the opportunity to experience that and know how to do that.
All right, Ms. Morgan, a little over a minute left here, but I want to jump to a recent deal, a $20 billion settlement agreement, the largest in history to compensate Indigenous children impacted by the underfunded child welfare system. So, what are your thoughts on this program? Is it enough to deal with this intergenerational trauma, with the hundreds of years of abuse that Indigenous communities have faced?
Well, of course, I'm never going to agree that it's going to be enough because there's been a lot of, irreparable damage. The $20 billion deal is a capper on what potential damage could have been done. There's no real true numbers that is attached to and account for, and you have to realize that for many of our First Nations children, if they were born with any kind of extra medical needs, and part of the practice, particularly in our provinces, is that if a community or First Nation didn't have the medical tools or resources or professional people to care, those children were automatically apprehended from their nations and put into the foster care system. And so that $20 billion has to account for all those children who were just apprehended merely because there wasn't enough care offered, or capacity for medical care in those communities. So it's encompassing a real large number of children, and I don't think there's a real true account of how many children that covers. So, and it's kind of up in the air between the age range of or years that this is happening.